yourself. And in the modern time, people also don't understand the cause of disease and do harm their health by neglect. This is Dr. Reichert Hammer. He is German, and he developed this German new medicine in the last century. So he was living in Italy, in Rome, and he's a doctor oncologist. He has his own clinic. The tragic event happened to him. His 17 years old son was killed by Italian prince. And shortly right after that, Dr. Hammer developed testicular cancer. And it was very suspicious for him because all his life, he had a healthy lifestyle, nutritionally wise, exercise wise. He was very, very healthy. And over the sudden, he got the testicular cancer. He started to think that, like, why? What is the cause of that? And because he had a clinic in his own clinic for oncology, he started to do his own research on his clients by asking them that if they had any kind of shocking event happen to them prior to the illness. He discovered that in 100%, all those people had something happen to them, like a really big stress. He tested thousands of patients. He asked them about the event, and he also did the tomography of the brain. And the brain was showing on the tomography that it was shock reflected in the brain. And that shock in the brain also would be connected to the organ. Dr. Hammer said, many of us will at one time or another experience a conflict and get cancer, but that is normal part of life and not such a bad things at all. Once one understands the principles of the 5 biological laws, people will understand how it all goes. And even if some people are concerned about German new medicine not embracing conventional medical beliefs, they will soon be convinced by the force of the logic, the beauty, and the general common sense approach of the German new medicine therapy. And also he said that disease is not an enemy, but a tool for resolving accumulated conflicts and stress in the body. So he has these 5 biological laws, and those laws were all tested on his clients, and every time with every person, those laws were working. So we cannot say that even that it's a theory, it's a theory if it's something, can go off the rule. That's why we call them law. It's kind of like universal law or law of the body or law of the nature, how it all goes. The first biological law, first criterion, every disease, and he didn't like to call it disease, and he called it significant biological special program, which in German an abbreviation reads like SBS. They all originated from Dirk-Hammer syndrome, or in German it's DHS. And Dirk-Hammer syndrome is he called it in honor of his son. His son name was Dirk, who was killed. So every significant biological special program originates from Dirk-Hammer syndrome, or a shock, right? Which is unexpected, highly acute, isolating conflict shock that occurs simultaneously in the psyche, the brain, and the corresponding organ. Second criterion, the content of the conflict determines which organ will be affected and from which area of the brain the significant biological special program will be controlled. And the third criterion, that every significant biological special program, or how we call it disease, they run synchronically in the level of the psyche, brain, and the organ. And that's how it looks like in the picture, the connections between psyche, brain, and organ. So on the left side, you see person is very shocked. And the reason of it could be somebody offended him, or he lost the territory, territorial loss, loss of income. It could be death. It could be death-frightened situation, like he found out maybe he had a cancer, or could be some abuse or sexual abuse, something really shocking. In that minute, when it happened, when it's the brain start to have already a reaction, and in a topography scan, you can see it as sharp circles, the semicircles, location happen anywhere in the brain. Okay, and it all depends of the content of the shocking situation. And then short time after that, that area of the brain which correlated to that organ send the signal to that organ, and the organ start to have either tissue growth or tissue loss. But for the body, the tissue growth or tissue loss is a biological necessary thing to do as a protection for the body, as a healing. In the brain scan, I forgot to mention that location called a homofocus. Okay. Next, let's see some examples how it all works and the psyche and brain and organ connections through some examples. For example, mother has some kind of nest worry conflict. For example, it's something connected to her little child. Maybe her child got very, very sick, or maybe like in a danger or something else. She got this conflict, right? And she has the focus on the brain in the cerebral mesoderm. That's the area will be affected if this is emotion happens. And then when child is okay and the conflict pass, sooner or later she may develop glandular breast cancer. If a mother has some kind of separation conflict, or mother or father, or any separation conflict, which you have like a deep emotion that was really hurtful for you, it will affect the sensory cortex, and it will be another kind of brain, intraductal. Okay, if there is like a death fright conflict in the person's life, let's say somebody just give you a not good diagnosis, brainstem would have that homofocus, and it can happen the lung cancer. Self-devaluation conflict, cerebrum, bone cancer, male sexual conflict, brainstem, prostate cancer, female sexual conflict, cerebrum, cervical cancer. All of those conflicts goes to different parts of the brain, and the signal sends to different parts of the body. Every individual have own subjective perceptions to this shocking situation. We're all different. We all come from different cultures, traditions, with different values, life experiences, vulnerability. Similar life events like divorce, death, financial problem, etc. We can react differently, subjectively. Okay, and the difference could be different and greatly different. For example, for some people, divorce can be experienced like a separation. For somebody like abandon, for somebody he will be very angry, and depends of the emotions person has. It may affect in separation breast. If it's abandoned, then it would be kidney, and if it's anger, it will affect coronary artery and also liver. Okay, so all depends of how every one of us individuals see the world and how we respond to stress. Okay, and choose to respond to stress rather than reflexively, like respondively, be responsive of your stress, knowing that the more negative emotions will affect you, the bigger location in the brain it will be, and the organ will have to do, lighter kind of special program of like a kind of heavy protection of your body. The second biological law, or the law of two phases, it has two phases. So when we have that shock and stress or conflict active phase, when this happens, the normal day-night rhythm is instantly interrupted and a prolonged state of stress begins. Nerves restlessness, insomnia, fast heartbeat, elevated blood pressure, slow digestion, frequent urination, bad appetite. Vessels start to constrict and bodies start to become cold by cold hands and feet. And that's why they call this phase of conflict, active conflict, is a cold phase, shivering from emotions from all the bodies in the stress. Okay, the brain, if you may have some kind of headache associated brain area where the stress is affecting it. In your psyche, you will be in very compulsive thinking mode. You can't sleep. You have to resolve the conflict, the stress. And the organ, they start to cooperate and improve the function so they can overcome the conflict. And some of the organs will grow tissue to protect it, and some of the tissue will be like losing tissue, right? Like osteoporosis or ulcerations. So when the conflict will be resolved, and the conflict can be resolved, person can just forgive another person or look at the situation differently from the big picture, or maybe his priorities shifted, or maybe he understood it somehow. So the conflict passed. And then when it starts to have the healing phase come, conflict phase, conflict resolved, go into healing phase. With the resolutions of the conflict, the autoimmune nervous system switches and a prolonged state of rest with fatigue but good appetite begins. And there's a desire to eat, provide the organism with the necessary energy for healing. Accompany symptoms like a slow pulse, low blood pressure, sleepiness. The blood vessels start to expand, body start to get warm, hands get warm, feet gets warm. They call it a warm phase. The psyche in this state is a state of relief. You're like, oh, the brain, you may feel like kind of edema or water hold, dizziness, could be a dull headaches because that also goes in the phase of recovery. And the organs which was affected, so if it was a tumor, it started to degenerate. It was ulceration, its construction sign, and return to normal size happens. Somewhere during the healing phase, it will be a healing crisis. Is like a pinnacle of the whole healing phase, like the most acute symptoms, and they could be very different symptoms, starting like with an acute headache, throwing up, fever, could be suddenly allergy like dermatitis all over. For some people it could be even stroke or heart attack. It's all kind of a healing crisis biological program. So the body does it too. After that, the regeneration start happens, so everything kind of like goes back to normal. Okay, the third biological law. Dr. Haber's medical research is firmly anchored in the science of embryology. Understanding where the certain cells come from help you to understand what type of biological special program the body will perform. The reactions in the certain part of the brain and specific organ is not random, but makes sense in the biological system. This system goes through embryonic development, and after the first 17 days, the human embryo forms three layers: endoderm, ectoderm, and mesoderm, which further develop tissues and organs in the body, and which all develop from one endocrine layer or another, and they all controlled by one part of the brain if it's from the same layer. So organs that derive from the endoderms, such as lungs, uterus, prostate, organs of alimentary canal, which is meaning from the mouth to the anus, they all correlate to the oldest biological structure like a brain stem in our brain. And the conflict will be related to some kind of breathing, food conflict, morsel conflict, or reproduction conflict. Okay, organs that derive from the old mesoderm, it will be skins, pleura, peritoneum, pericardium. They cover in the vital organs, and they primarily responsible for the protection or attack conflicts. They controlled by the cerebellum in the brain. Organ that derive from the new mesoderm gives stability and mobility to the body. It's like muscles, bones, tendons, ligaments, connective tissue, and also lymph systems in blood vessels in there. And they react to the conflict of self-devaluation and controlled by cerebral medulla. Organs that derive from the ectodermal tissue covers with endodermal submucosa of most organs and lines the ducts within the organs like bile ducts, pancreatic ducts, milk ducts, also cervix, uteri, bronchus, heart vessel. They correlate to more advanced conflict like social contact conflict, like separation, sexual conflict, territorial conflict. They control from the cerebral cortex. The fourth biological law: diseases are not contagious. Microbes, bacteria, fungi are all very important for our survival, and they are necessary for the restorative phase of the conflict. They are called seasonal workers for cleansing organs. If antibiotics or chemotherapy will be used, the problem remains in the phase and go to the further growth. According to the fourth biological laws, microbes are not the cause of infection disease, but favorable steering wheels in the healing phase. The fifth biological law: disease is not an error. Your body is not making a mistake. Every disease is a part of the significant special biological program that helps the body to resolve a biological conflict. And you can trust your body. German new medicine works for both, for human, for animals, for everything alive.